we will discuss asthma, a chronic respiratory disease. We'll cover how to detect asthma, the top 5 signs and symptoms, diagnosis, treatment, and conditions that resemble asthma but are not. During asthma, a person experiences attacks or episodes of difficulty breathing and coughing. The first and most common symptom of asthma is wheezing, occurring in almost 90% of cases. Wheezing is a high-pitched whistling sound made while breathing, usually during expiration. This wheezing can occur during physical activity, respiratory infections, or due to allergies. The second most common sign is shortness of breath, represented in about 80% of cases. It means difficulty breathing or feeling unable to take a deep breath. This symptom can be triggered by exposure to cold air, running, climbing stairs, stress, or respiratory infections. The third most common sign is coughing, which may be dry or sometimes with mucus. Coughing occurs in 70 to 75% of asthma cases and is usually worse at night or early morning. It is triggered by cold air, exercise, or respiratory infections. In some cases, it may be the only symptom of asthma, known as cough variant asthma. The fourth most common sign is chest tightness, a feeling of pressure or constriction in the chest. It is described during asthma attacks alongside other symptoms like shortness of breath and wheezing. Chest tightness is present in around 60% of asthma cases. The fifth most common sign of asthma is increased mucus production, especially during asthma attacks. This occurs due to irritants, smoke, or strong odors. Many people with asthma feel a constant irritation in their airways, leading to a persistent need to clear their throat or cough, even if they can't always expel mucus. Around 60 to 70% of individuals with asthma experience a constant need to clear their airways, especially during exposure to triggers or low-grade, persistent inflammation. All these symptoms occur due to inflammation of the airways. They become swollen and inflamed, causing narrowing and obstruction. Additionally, bronchoconstriction further tightens the airways, and excess mucus production clogs the already narrowed airways. This happens because the airways become overly sensitive to various triggers such as allergens, irritants, cold air, and exercise. Asthma has several types. For example, allergic asthma, also called extrinsic asthma, is triggered mainly by allergens like pollen, dust mites, mold, and pet dander. Allergic asthma is more common in children and young adults with a history of allergies or a family history of asthma. It is usually well managed and often improves by adulthood. Non-allergic asthma, or intrinsic asthma, is not triggered by allergens but by infections, stress, cold air, and sometimes exercise. Exercise-induced asthma is when a person has symptoms exclusively after exercise. Occupational asthma occurs when symptoms are related to workplace pollutants. In cough variant asthma, the primary symptom is a persistent cough without the classical other signs and symptoms. Nocturnal asthma is characterized by symptoms that are more pronounced at night. Aspirin-induced asthma is triggered by taking aspirin or other nonsteroidal anti-inflammatory drugs, NSAIDs, and is often associated with nasal polyps and sinusitis. Asthma is diagnosed when a person has a history of recurrent episodes of wheezing, cough, shortness of breath, and chest tightness. During a physical examination, the person may have wheezing sounds, but breathing can also be normal. Lung function tests, especially spirometry, are used to measure lung function. Spirometry measures the forced expiratory volume in 1 second, FEV1, which is the amount of air you can forcefully exhale in 1 second, and the ratio of FEV1 to forced vital capacity, FVC. The FEV1-FVC ratio is typically between 75 to 80% in adults and slightly higher in children. Asthma is suspected when this ratio is less than 70%. Forced vital capacity measures the total amount of air you can exhale after a deep breath. An improvement in lung function after taking a bronchodilator also supports the diagnosis of asthma. The peak expiratory flow, PF, measurement tests how fast you can exhale. In some cases, immunoglobulin E is elevated, especially in allergic asthma. Approximately 30 to 40% of asthma cases are non-allergic, where IgE levels can be low to normal, while the remaining 60 to 70% typically have elevated IgE levels associated with allergic asthma. Significant changes in PEF readings over time can indicate asthma. Around 50% of asthma cases are diagnosed in childhood, commonly at around 5 years old, with another 50% during adulthood. About 30 to 40% of asthma cases are not severe enough to be diagnosed and remain undiagnosed. Chronic bronchitis, chronic obstructive pulmonary disease, COPD, and gastroesophageal reflux disease, GERD, may have symptoms similar to asthma. The key differentiating factor for asthma is its reversible nature, while diseases like chronic bronchitis or heart failure do not improve over time. A significant improvement in FEV1, at least 12%, after bronchodilator inhalation strongly suggests asthma. 40% of childhood asthma cases will recover by adulthood on their own, while asthma in adulthood usually persists throughout life. The principle of asthma treatment is to control symptoms, prevent attacks, and maintain normal lung function. Asthma treatment: very mild cases, short-acting beta-agonists, SABAs, like albuterol, also known as salmeterol, are used during asthma attacks. Mild persistent cases, inhaled corticosteroids such as budesonide, fluticasone, and beclomethasone are highly effective when used daily. SABAs are used as needed during attacks. Moderate persistent cases, low-dose inhaled corticosteroids are combined with long-acting beta-agonists, LABAs, like salmeterol or formoterol, along with a rescue inhaler, SABA, as needed. Severe cases, in addition to the treatments above, leukotriene modifiers like montelukast, theophylline, or biologics such as omalizumab and mepolizumab are used. Asthma is a chronic condition that often requires long-term management, meaning lifelong treatment in many cases. While children may see significant improvement or remission, many will need ongoing treatment to maintain control and prevent exacerbations. Risks of uncontrolled asthma: if left untreated, severe asthma attacks can be life-threatening, causing approximately 250,000 deaths globally each year, many of which are preventable with proper management. Uncontrolled asthma increases the risk of respiratory infections like pneumonia and bronchitis, which can further exacerbate asthma symptoms and lead to additional complications. It also increases the risk of developing chronic obstructive pulmonary disease, COPD. Lifestyle and environmental modifications: avoid asthma triggers. Engage in regular exercise. Maintain a healthy diet rich in fruits, vegetables, whole grains, and lean proteins to support overall health and immune function. Example: incorporate anti-inflammatory foods like omega-3 fatty acids found in fish, flax seeds, and walnuts. Practice stress-reducing techniques such as yoga, meditation, and deep breathing exercises. Proper management of asthma, including both medication and lifestyle changes, can significantly reduce symptoms and improve quality of life.